Well, we are going to be focusing on asthma, and as you are well aware, asthma is a chronic inflammatory disease of the lungs characterized by airflow obstruction that is reversible. And patients come in with increased airway hyperresponsiveness that leads to symptoms of wheezing, shortness of breath, chest tightness, and coughing. And so if we look at the EPR, the expert panel report for diagnosis and management of asthma, they talk about 4 different pillars in respiratory diagnostics and assessment. And at the bottom of this, we see inflammation, and inflammation is what really drives things like airway obstruction and airway hyperresponsiveness, and that leads to the symptoms that patients come in to see you with. The problem with asthma is that there's a variable presentation. They have different triggers, they have different symptoms, they have different severities and different responses to therapies. And so as providers, we want to have objective ways of measuring each one of these contributing factors. And so how do we do that? Well, for symptoms, we can use things like asthma control questionnaires. So the ACT test, ACQ are examples of that. We use spirometry to measure airway obstruction and bronchodilator response. If we're wondering about airway hyperresponsiveness, we can do things like methacholine challenge tests. And then we use things like, we use exhaled nitric oxide to measure airway inflammation. And so there's interplay between all of these different pillars that we talk about in asthma management.